KCTV5 is tracking the COVID vaccine. 25% of Americans are now fully vaccinated. That's according to the latest numbers from the CDC. And we are really starting to see a big increase in the supply of shots. The University of Kansas Health Systems is looking to fill 6,000 open appointments. We asked doctors, why so many?
The planning around when increases in vaccine supply would happen, where actually those dates were later out. So now we have more than we planned for, and we hadn't really built up all of the infrastructure to recruit people at the right time to fill them.
The appointments are open to anyone who lives in Kansas or works in Johnson County. If you're a patient, log on to MyChart. If you're not a patient, go to kansashealthsystems.com/vaccine, or you can call 913-588-1227.
Should you be forced to get a shot? It's a debate many lawmakers, companies, and schools are having. But local doctors say the issue is really nothing new.
I think what we will find is that more companies and more hospitals and more other groups will begin to say vaccination is mandatory. We do that with the influenza vaccine. We do that with other vaccines, MMR and things like that.
There are a number of shots that are required to attend school in Kansas and Missouri. Here's a list of them. Several other shots are also recommended, but not mandatory. Now, if enough people don't get the COVID-19 vaccine, we could end up back at square one.
If you haven't been vaccinated and you get infected by the coronavirus and it mutates, not only can you give that coronavirus to someone else, but if the mutation is somehow different that the vaccination process doesn't recognize, then the vaccinations become ineffective. Then you can infect everyone, and we have to start all over again.
Of course, local doctors are really hoping it will not come to that. If everyone gets a shot, the virus will lose strength and become a lot like the flu or common cold.